This is for the crown and bridge prep tray setup. Here is the topical anesthetic gel to go before the site of injection, and here is the cotton tip to apply the anesthetic gel. Here is the anesthetic cartridge, and that's to hold the liquid for the anesthetic for the local injection. And then next is the anesthetic aspirating syringe, and that's to administer the local anesthetic rather with a long or short needle. Here are the 2x2s and the cotton rolls, and this basically is just to isolate the teeth or to keep the area nice and dry. Next, we have the HVE and the saliva ejector, and we would have the air water syringes. The HVE is to basically get out any saliva or debris. The saliva ejector is as well. Air water syringes is to rinse and dry the mouth. This is dental cord, and it helps focus on repairing the tooth without the gums getting in the way, and the dental cord also helps make sure the whole tooth gets recorded when an impression is taken. Hemodent is to suppressing bleeding during crown preps. Here's the high-speed handpiece, and this is used to cut the tooth structure, cut bone, and to remove decay or restorative material. And here is the burr block, and it depends on the dentist which burrs they would like. Here are the crown and bridge scissors, and this is to cut any gingival retraction cord, to trim any temporary crowns, to cut a dental dam. This is a bite registration tray to use for taking bite registrations for crown and bridge procedures. Next is the mixing gun for dental impression material, and this is to mix the material for bite registration. This is the light body for the impression. This is a shade guide, and it's to select the shade for permanent fixed restorations to look just like the tooth. This is temp bond, and it's basically to bond the material to the restoration. And this is the mixing pad to mix the catalyst and the accelerator on. Here's the mouth mirror, and that's to provide for any indirect vision or to retract the lips, cheek, and tongue. Next is the Explorer, and this is to examine teeth for decay, calculus, furcations, and other abnormalities. Here is the spoon excavator, and that's to remove carious dentin or to remove temporary crowns, temporary restorations. Gingival cord packing instrument, and it is to push down the gums and to see the whole tooth. This is a Woodson. It's to carry and place temporary restorative material to the cavity prep, and then the plugger end is to condense the restorative material as well. These are the cotton forceps, which is to grasp or transfer items into or out of the oral cavity. I believe this is a curette, and this is to scale the supra and subgingival surfaces to remove deposits and stain from the teeth and to remove soft tissue lining of periodontal pocket and root planing. Called hemostat, and it's to grasp tissue or bone fragments, and it's to hold and grasp material in or out of the oral cavity. This is articulating paper and the paper holder, and is to check the centric and lateral occlusion. This is IRM, and it is basically a temporary cement filling and will return for a later date for the restoration.